Spinning down the foul line. Left side of the lane goes Bias. Makes his move. Throws up the shot. It falls. He's fouled. And the basket counts for Bias. Incredible move. You explain that.
Len Bias, powerful, 22, winning the career in pro basketball he'd worked for all his life.
Len Bias with 29. Oh, my! And he makes the steal and a jam!
I awakened one beautiful Thursday morning, June the 19th, to a phone ringing. When I picked it up, someone said, "Mrs. Bias, Len is sick. They've taken him to the hospital. He's having seizures." I was expecting to go there and say, "Son, how are you doing?" I had no idea that he would be dead. We went into the examination room and looked at him, and I saw his huge frame lying there, and I just bent over and kissed him. I said, "He's gone," and I left. I miss him so much, especially now, because the basketball season is over, and we're accustomed to having him to come home, and no one is coming in. You know he's not coming in.
Len Bias died of a heart attack from taking cocaine. His death gave lots of publicity to the fact that drugs don't hit only the brain, and it spurred a wave of new drug research around the country. This new research is finding alcohol and cocaine do greater damage in greater variety to many more parts of the body than we'd imagined. A study out just this month suggests that even small amounts of alcohol dramatically increase the chances of breast cancer in women. In fact, alcohol, we're now finding, can damage everything because it weakens the basic unit of the body itself, the cell. And you don't have to be addicted for alcohol or cocaine to do their damage. We'll start with the heart. Even there, it's more complex than we'd thought.
Turns out that there are at least 4 different ways, 4 different actions that cocaine can have on the heart that can result in heart attack or fatality.
As soon as it enters the body, cocaine increases heart rate and raises blood pressure. It can cause arrhythmias, sudden and dangerous changes in heart rhythm, myocarditis, alterations and weakening of the heart muscle, and spasms of coronary arteries, which means the blood supply to the heart can be shut down and the heart stop beating.
I was having muscle spasms, messing with coke. And I had muscle spasms so bad that they had to call an ambulance on me. And I had to go to the door. I was having a heart attack.
Today, there are 4 times as many deaths from cocaine as there were only 4 years ago. Most of those deaths due to cocaine's effect on the heart.
People as young as 16, 17, 18 would be experiencing rather serious cardiac symptoms as a result of taking cocaine. And they began to appear in treatment centers, and I began to ask questions. How many of you who are doing cocaine have chest pain? How many? Put your hands up. Approximately 50, 60, 70% of the hands would go up. How old are you? 18. You're 18 years old and you're getting chest pain? That's unheard of.
Beyond the heart, cocaine's growing danger list for the body includes sudden epileptic-like seizures, which can lead to respiratory collapse, weakening of hormone production, which can block proper growth and sexual maturity, constriction of blood vessels, starving the whole body of proper nutrition. And now science has discovered that some of us are more vulnerable to cocaine's assault.
Certain individuals lack an enzyme in their bloodstream which is responsible for breaking cocaine down. And for individuals of that sort, they are at much greater risk when they take cocaine. The average person, of course, wouldn't know whether or not they had this deficiency. So there are people who can be affected by very low doses of the drug and produce fatalities.
For all this dramatic new information about damage from cocaine, many more deaths, much more physical suffering are caused by alcohol. Alcohol kills 98,000 people every year, puts at least 519,000 in the hospital.
maybe 1 out of every 4 beds in the hospital, or every 3, and some hospitals even 1 out of every 2, is occupied by somebody who's there for the damage that alcohol has done to one organ system or another.
At the VA hospital in Manhattan, the variety of patients' complaints shows the variety of alcohol's damage.
My doctor have told me that I have a disoriented heartbeat. It skips beats. And swelling of my liver from the alcohol.
Hold your breath, please.
We've long known alcohol destroys the liver, causing the deadly hardening of delicate tissue we call cirrhosis. 29,000 deaths a year. We've now discovered alcohol is also toxic to bone marrow cells, causing anemia, a general weakness and lack of energy.
Good. What we got today? Something good?
Oh, you enjoy that. You like that very much.
Thank you very much, and have a good day.
Robert Raffini.
Alcohol also breaks down the nerves which control our muscles and degrades the power and rhythm of our one non-stop muscle, the heart.
I can think of 2 guys that died of heart attacks, and a week before Christmas I lost one of my closest drinking buddies. He died of a stroke while driving a car.
But the main thrust of the new research in alcohol points to its ability to cause damage everywhere in the body.
Life is deteriorating very fast. The liver, kidney, heart, lungs, how many more? Pancreas.
Much of the new research is on alcohol's attack on the basic biological unit of the body, the cell itself, any cell.
I think one of the surprises has been that alcohol can have effects on cell systems outside of the brain in ways that we never before imagined. Alcohol does dissolve into membranes of cells and does alter the ordered structure of these membranes so the cell does not respond properly to its environment. And this can happen in the liver, it can happen in the heart, it can happen in other organs of the body as well.
Now that scientists have discovered alcohol's attack to be much more widespread in the body than they expected, they're driving to learn one more secret. They want to know how the alcohol molecule does what it does. In this study of basic cell structure, this instrument takes the chemical fingerprint of one tiny human cell. Each colored ridge reveals a different chemical in the cell. They're trying to find out which of those chemicals interacts with the incoming alcohol molecules, and how.
We must be able to find some scientific understanding for how alcohol results in organ damage. It's a very simple molecule, and we still have no idea. We're still fumbling with it.
Until they discover that, scientists have little chance of controlling any of alcohol's damage, much less repairing it. These older victims of alcohol never expected when they took their first drinks that for predetermined biological reasons, some of them wouldn't be able to stop, or that their bodies would be so degraded, their lives so diminished. More of our children are drinking alcohol now than ever. We're only now learning that many of them, for biological reasons, can't help it. In a moment, we'll take a fresh look at alcohol and the young.